My name's Denise Jenkins and I'm a local girl. I'm from Splot here in Cardiff. Naughty schoolgirl, I suppose, 15 maybe, 16. Okay. So that's 50 years ago. It affects it in a way, makes you antisocial, again, around people who don't smoke. It certainly affected my health. I got three main health conditions. One is COPD, which is a no-no when you're a smoker. I suffer with rheumatoid arthritis and I suffer with osteoporosis, none of which smoking is good. What I told people was a different thing to what I actually smoked. And I think I probably told Kathy I smoked 40 a day, but there was days when it was a lot more than that. I did it everywhere, it didn't bother. I smoked in the car, I smoked in my house. I mean, I got grandchildren, they used to come in and say, oh, Nanny stinks in here, you know, but it, unfortunately, at that time, didn't make any difference to me. It does now. It does now. I just had all my house decorated and it all smells lovely now. Of course, yeah, it goes without saying I was ashamed. I go away once or twice a year with my friends. There's four of us and I'm the only, or I was, the only smoker. So nobody wanted to come in my car and we always used to go in the non-smoking car and then I couldn't have a cigarette and I'd be the only one during lunch or something that would nip out for a quick cigarette. So yeah, it had a major impact. When I used to come here for an appointment, my COPD clinic is here just across the other side of this room, I couldn't get up the stairs. I won't use a lift. So I used to come 30, 40 minutes early, come up the stairs and then sit in there for about 10 or 15 minutes trying to catch my breath before they called me into my COPD clinic. I remember my first words to Kathy because I went into my COPD clinic and it was a really bad session and I was really poorly and we discussed what I could do and I said I wanted to give up smoking. Sort of meaning it, but not 100% committed. And I had tried before, but I went to a smoking clinic in a group of people and it didn't work for me. I was new and they were all coming to the end of their sessions and they'd felt as if they were non-smokers and I didn't get an awful lot from it. So my COPD nurse, Madeline, arranged for me to see Kathy on a one-to-one basis. Okay. And it was the best thing that could have happened. And my first words to when Kathy said to me, why do you want to give up smoking? I said, because it's killing me. That bad. It was that bad. It was easy. It was made easy. We discussed everything. We wrote things down. We met regularly. She was there for me on the end of her phone if I needed her, but I don't think I ever did. But she was there and she made me feel I could do it. And it gave me the confidence and I didn't want to let Kathy down and I didn't want to let anybody else down who was giving me support either. It's been tough, there have been tough days, but there have been other days when I haven't even thought of smoking. When I went through the sessions with Kathy and we went on the patches, I finished my first patch a bit early, I finished my second patch session a bit early, and I finished the third patches a little bit early as well. I've also got a spray, which Kathy kindly issued as well. And I barely use it. I think I've used, out of 18 sprays, I've used 2, which I think is really good. Tomorrow will be 3.5 months. Well, I love the theatre, and I was not going very often because I couldn't get up the stairs in either the Millennium or in the new theatre. And now I'm going twice a week. And then I go in the evenings and I go with my friends and I'm up the stairs before they are. My sense of smell and my taste buds are all completely different now. I smell things. I go through the park and I can actually smell flowers and I couldn't do that before. Today, while we're sitting here talking, I can smell smoke. It must be a barbecue or something going on outside, but yeah, and I wouldn't have smelled that before. That would have been me I could smell, not outside. But I thought I was always going to smoke. I honestly believed when I started this programme I would cheat somewhere along the line, and I haven't. Kathy, as I said, she's been super supportive. We've discussed everything. We agreed everything, which was important. There was no overkill. It was as and when we went along. She was just in here for me all the time. And the positivity, you can do it, not, you know, well, if you give up this time, you'll try again. It was always positive. I just haven't looked back since I've come. Simple as that, really. Kathy told me about the little app that I can put on my phone as well. So I've used that religiously, and it gives you lots of hints and tips. But one of the things it does is it tells you how much you can save by packing in the smoking. And I've saved to date £2,328, and that's in 3 months and 2 weeks. I can tell them if I can do it, anybody can do it. It was that bad. It was getting to the stage. Things wasn't particularly good in my life at the time, and now that's different. And I was smoking 60, 80 cigarettes a day. And I think most smokers lie about how many they smoke. And yeah, so considering I've given up so quickly and so well when I was probably smoking double what I told Kathy, so I'm sorry, Kathy, but I did in the beginning, you know, and as I did to my COPD nurse, I liked her too. So along with Kathy and the COPD nurse who changed my medication at the same time, I am a new woman, and that's a fabulous feeling. So if I can do it, anybody can.
So Help Me Quit is a non-smoking service for everybody in Wales. It's an NHS service, so it's free for everybody. Ways to access the service, you can just put Help Me Quit into Google and you can just send a message through to the contact centre and someone will get back to you. You can also phone us on the free phone number, which is 0800 085 2219 to access the service that way. If you go into your GP and as Denise was having the referral from her nurse, you can either be referred by your doctor or by the nurse at the GP surgery. You can, if you find yourself in hospital, you can receive access to the products through the hospital. Somebody will come out and see you. There'll be an advisor on site that will come out and see you and provide you with those products. And then once you come out of hospital, you should be provided with products out in the community. We also provide a pharmacy service. Not every pharmacy will provide the products for you. They need to have a specialised pharmacist within the pharmacy. So if your local one doesn't do it, the pharmacist there will be able to tell you where your nearest pharmacy is. And then finally, the community access, which is where we work and where Denise had her sessions. So there's a group of 4 of us across Cardiff and Vale, and we cover various areas right the way through Cardiff, either in doctor's surgeries or in the hubs, some sort of community setting where we'll see people either on a one-to-one or in a group setting, as Denise has described. But for those people who maybe have mobility problems, are too unwell to come into clinic, or indeed are working, we can provide telephone support for them. They'll receive 12 weeks of products free of charge, and that comes to around a cost of around £250, so it's very worth it. Stop smoking products are very expensive, but alongside that you also get 7 weeks of support. So the person will either come in or receive a telephone call every week. And then for the last 5 weeks, if they still feel they need a bit of extra support, we're there at the end of the phone if they need it. Incredibly proud. So Denise came, a very poorly lady at the very beginning. She was struggling to walk, she was struggling to do anything really. She had no social life, she was unable to spend time with her friends. Her friends were going out and doing things and she couldn't do it with them. She couldn't go places, she couldn't go for coffee. There was lots of things that were really limiting her life, and a lot of that was down to the COPD, the lung disease that she had gained from smoking. Marilyn, the nurse here, had referred her across to me, and as she's mentioned, she changed the medication. And every time somebody comes in, we do a carbon monoxide read, which gives us a really good idea of the levels of that toxic gas within somebody's body. And normally on that first visit, it's very high if you're a smoker, but can drop very quickly. So it's a real motivator for people when they come in. But unfortunately, Denise was unable to breathe even well enough to do that read I think she scored something that was much lower than would have probably been had she been able to use it properly. She would have blown a number much, much higher. So she was a very poorly lady and very, very desperate to quit. So yeah, I'm incredibly proud. She was a different person at the end of the sessions than she was at the start.